We live right now in times of uncertainty. All the systems we knew once are collapsing. Where did we go wrong? What did we do that has led us here? Before moving forward, it is worth mentioning right now that this video is not intended to offend any particular group of people. Rather, this is our amateur analysis of just a few things that we found out. As we all know, the healthcare system is in ruins right now, and COVID-19 has taken the world with a far more powerful grip than any of us were prepared for. In microeconomics, we learn that the cost of something is what you give up to get it. In other words, when a government decides to spend a given sum of money on buying weapons instead of on, say, building a hospital, healthcare becomes an opportunity cost. But we asked ourselves, is this cost worth it? For our analysis, we looked at two case scenarios, that is, the country with the best healthcare system and that with the worst one. Through the various data that we collected from publicly available posts made by the World Health Organization, we found out that the country rated as the best healthcare provider is France, and the one rated as the worst healthcare provider is Sierra Leone. Being of Pakistani origin, however, we also tried to take a look at what our governments have done in the past and what needs to be done in the future. Our findings are as follows. So let's take a look at Sierra Leone. We know that out of the country's entire budget, it allocates 13.8% to healthcare development. According to the World Health Organization and its Health Quality Index, the country ranks an absolute 0.0 on a scale of 0 to 1. In 2018, Sierra Leone's HDI value was 0.438, which kept the country at a position of 181 out of 189 countries. Globally, infant mortality rates remain among the highest. 1 in 17 women risk dying during pregnancy or childbirth, making the country with the highest maternity mortality. We see from the data that we've collected and from other resources that the major causes of illness are preventable with some simple modern-day advancements and technologies. Simply put, the healthcare system in Sierra Leone is in the worst possible case that it could ever exist in. So now let's look at another country, France. On that same health efficiency index, France scores 0.994, which makes it one of the world's best healthcare providers. Its HDI values in 2018, in contrast with those for Sierra Leone, were 0.891, which places the country at a position of 26 out of 189, and makes it one of those with a very high human development. The average life expectancy in France at birth is 81 years. France also has the safest maternity and infant facilities. It is also among the few countries that cover mental health and general health care plans without charging extra cash for basic psychological or psychiatric consultations and prescriptions. In its 2000 assessment of world healthcare systems, the WHO found that France provided the best overall healthcare in the world. Approximately 77% of health expenditures are covered by government-funded agencies. The government has assumed responsibility for the financial and economic administration of health insurance by fixing income-related premium rates and regulating the costs of goods and services. Now, do you see the general trend that we're trying to show here? One can argue that France's HDI values and its overall wellness that we see in its people is due to a number of reasons, all the way from the political stability the country has in contrast to Sierra Leone, to how they have access to other facilities such as infrastructure and education. But the idea here, the core idea, is so central and so obvious that if you simply focus on actually trying to improve the quality of life of your people, your economic well-being will improve as well. So now that we're done looking at two extremely different scenarios, that is, the best and the worst, I want you to pause the video right here and read whatever is on the screen in front of you and make your own judgment about where the country of Pakistan is right now. I want you to read these things and try to get an idea or make a guess about where the country is headed in the next few years. Done yet? Okay, so here is our take on the whole situation. When it comes to everyday healthcare and life insurance policies, Sierra Leone has negligible efficiency in the area. France, on the other hand, is excellent, but Pakistan is only moderate. On the other hand, when you come to something as basic as mental health care, Sierra Leone is again negligible, and France is good, but Pakistan is poor. The same patterns lie throughout in different areas of our lives. As you can see here, there are different budget allocations that these three countries make, and the kind of healthcare facilities that they're able to provide their people are very evident in the budgets that they allocate to their healthcare systems and in the importance that these countries place on healthcare development. And then you can also see the economic development and economic growth of these three countries and how a similar pattern lies in that area as well. All of that being said, we conclude that Pakistan is far behind in its journey to providing its people with the kind of quality of life that they deserve. The ugly truth is that Pakistan's healthcare system is not provided by the government. It never has been. Instead, the healthcare system relies on private institutions, and if you were to take those away, then our situation would become far worse than that of the worst case scenario that exists right now. We cannot afford to have another pandemic. We cannot afford to go on the way that we go on with our lives, ignoring basic things such as health.